The intricacies of COVID-19 can be challenging, but the fight against the virus is inevitable. Tonight, we'll take a look at the state's intervention and hopeful flattening of COVID-19 curve in Nigeria. Have a good evening and welcome to Weekend File, the place to be on a Saturday evening. It's no longer news that 34 states in Nigeria and the FCT have been grappling with the devastating effect of COVID-19. Lagos, Kano, and FCT are top 3 on the list of the affected states in terms of numbers, while many other states are also experiencing gradual but steady increase in the number of new cases on a daily basis. Both the federal and state governments have been on top of the fight with initial 4-week lockdown of Lagos, Ogun, and FCT, with similar measures taken by some subnational governments. With the ease of lockdown and sustained upward trajectory of COVID-19 infections, government is now concerned about compliance by Nigerians with the safety precautions aimed at preventing more spread of the virus. This is very crucial at this moment, considering increased number of deaths and community transmission recorded in some states. The big issue at this time is how the state interventions can flatten the COVID-19 curve, which is currently on its ascendancy stage. It's been widely reported that many people are disregarding the PTF guidelines, especially social distancing and interstate travels, which is happening across the country even as I speak. All that playing out despite regular awareness campaigns against the virus is difficult to comprehend. Flattening the curve is not going to be easy according to experts, but the fight is very much on. My guest today is Dr. John Oladejo, Incident Manager, National Coronavirus Emergency Operations Center. I am Kirian Umayo. It's good to have you on the show today as always. And I will start with the news. Over 4 million persons infected globally with coronavirus disease as Nigeria death toll jumps to 117. Over to Adebola Brooklyn Sunday for update on COVID-19.
The Nigeria Center for Disease Control has tested 23,835 persons for coronavirus disease, as the country's confirmed cases is about to reach 4,000. Active cases now 3,912. After 679 persons have recovered, Nigeria, as at 8th of May, recorded 10 fatalities. However, no new states reported a case in the last 24 hours. On the ranking, Lagos, Kano, Borno states and the Federal Capital Territory maintained their positions on the top of the table, while Katsina displaced Gombe and few other states to clinch the 5th spots. Bayelsa, Imo, Benue, Abia and Anambra states booked their places at the bottom of the table. Currently, on the dashboard of the African Center for Disease Control, the continent has 57,746 confirmed cases, 2,151 deaths, and 19,351 recoveries. In Afghanistan, several people have been killed in the western province of Ghor after clashes broke out between police and protesters during a demonstration against alleged mismanagement of aid to alleviate the effects of COVID-19. Meanwhile, data from China National Health Authority shows that the country reported 1 new but imported coronavirus case at the end of Friday. The commission also reported 15 new asymptomatic cases. China's coronavirus cases now stand at 82,887, 78,000 recoveries, while the official death toll remains 4,633. At about 7 p.m. Nigerian time, tally from Johns Hopkins University for COVID-19 shows that 4,044,792 persons have been infected globally, while 277,087 people have died. 1,405,042 persons have recovered. I am Adebola, Brooklyn Sunday.
Thank you, Adebola. The federal government is collaborating with the various subnational governments to provide more bed spaces at the isolation centers and ensure quick recovery for coronavirus patients. The Minister of Health was speaking this Saturday on NTA nationwide program.
They have had to mobilize bed spaces from hotels and schools, and in fact, hotels that had already been for another purpose, like the orthopedic hospital. That is what we expect other states to be doing. The speed with which the number of cases increased has surprised a few governors and a few states. So the target of 300 beds that was initially mentioned hadn't been met by any of them. So we are urging them to open hotels and hotel proprietors to make their hotels available, perhaps convert some dormitories in schools into centers for holding positive patients. So the facilities at the Do train station are almost ready. The facility at the Dome will be ready in a few days. In fact, we'll be commissioned next week. So for spaces in Abuja, we are not yet so constrained. So it's a matter of persuading those who are positive that they need to stay in the isolation facility so as to contribute to protecting the health of the population.
The Minister of Health, Dr. Ehanere there. The Ministry of Humanitarian Affairs, Disaster Management and Social Development has taken its COVID-19 response outreach to persons living with disabilities in the Federal Capital Territory. Ruth Aguele was at the Karimajiji, where the community of persons with special needs received food items and others.
In anticipation, the people of Karimajiji community awaits the arrival of palliatives to their end. Finally, the wait is over. Food items and wrappers being offloaded for distribution to persons living with disabilities by the Ministry of Humanitarian Affairs, Disaster Management and Social Development as part of its COVID-19 response outreach. Aisha Inu is one of the beneficiaries. For her, these palliatives will go a long way to reduce the hardship she faces with her two children. About 460 households of about 1,000 people are to benefit.
And we expect that they bear with us and use what we have given to them judiciously, and also look forward to how we are going to really support them more and assist them more to have a means of livelihood.
This is a very good thing, and we are proud of what federal government is doing through the ministry.
This is not the first time the ministry will be visiting this community to distribute palliatives, as persons living with disabilities are given priority in the ongoing distributions across the country. In Abuja, Ruth Aguele, NTA News.
There's no better way of extending a helping hand, especially at this time of coronavirus pandemic and month of Ramadan, than providing succor to the less privileged. Durumi community in the heart of the 8th city has seen the light at the end of the tunnel with the donation from the wife of the National Security Advisor, Nafisa Mungudo.
It is a double joy for the Muslim Ummah in Durumi as a heavy downpour cools the heated atmosphere, reducing the impact of fasting, and then to receive the food items to feed the needy in Ramadan from the wife of the National Security Advisor through her NGO, Precious Little Lives Initiatives. which focuses on changing the lives of the needy, especially children. Religious and community leaders of Durumi received the items, which are to be distributed to the less privileged in the community as palliative to help cushion the effects of the coronavirus pandemic.
This is not the first time we are receiving palliative from the wife of the NSA. At least this is the fourth or fifth time that we have received items from her.
The support from the wife of the NSA NGO to Durumi community is in response to government's call to groups and individuals to help stop the coronavirus pandemic.
We need to at all times abide by the advice of authorities and healthcare workers.
Apart from rice, noodles, shoes and many other sundry items donated, face masks were also distributed, and a sensitization on the need to maintain personal hygiene and social distancing to curb the spread of the virus was carried out.
Kaduna State government is adopting stiffer measures to contain the spread of coronavirus through interstate travel. Mohammed Omar Ajingi reports that Governor Nasiru El-Rufai, in his first public appearance since recovery from the virus, led a team of the state officials to major entry points in enforcing interstate travel ban.
Security personnel and government officials led by the governor all out to enforce the interstate travel ban with major entry points, Kaduna Abuja Highway and Kaduna Kano axis as centers of operation. Only vehicles conveying food items are allowed passage after a thorough search. The governor says the fight against coronavirus pandemic in the state is total and more stringent measures will be applied to win the battle.
Virtually all the cases we've had in Kaduna have been from other states. So we have a duty to ensure that the sacrifice of Kaduna State people is not in vain and keep everyone out. So this is why I'm here, and I will be here from time to time. And from today, from 6 p.m., we close our borders. No vehicle will be allowed to pass. Any vehicle that comes to this border with Kano will have to spend the night because the road will be completely blocked.
The enforcement team visited one of the mobile courts provided to sanction violators. In the same vein, the state deputy governor led another set of enforcement team to Hunkwe axis, the boundary between Kaduna and Katsina state. Illegal interstate travel is widening the transmission of coronavirus in the state, as majority of positive cases are people who came in from highly infested states. In Kaduna, I am Muhammad Umar Ajingi, NTA News.
More strategies have been evolved to contain the spread of COVID-19 in Sokoto State. This is coming as Governor Aminu Waziri Tambuwal inaugurated a response volunteer team to support the fight against the pandemic. Dalhatu Abdullahi has the report.
Sokoto State recorded its first confirmed COVID-19 case on the 20th of March 2020, and the figures have continued to rise through contacts tracing by the officials of the task force in the state and the NCDC. Several measures have been devised by the state government and the relevant stakeholders to contain the spread of the pandemic. Sokoto State government has taken another lead by inaugurating a team of 1,000 COVID-19 response volunteers to step up proactive measures aimed at containing the spread of the pandemic. They comprise of medical doctors, nurses, medical laboratory scientists, pharmacists, and other enlightened individuals in the state. Tambuwal assured that the volunteers will enjoy daily modest allowances for their personal sacrifice to come in contact with COVID-19 patients.
So please, don't let us stigmatize our brothers, our sisters. We should encourage them, we should hold them so dearly. They are our own brothers, they are our sisters. It's only an affliction, it's not a death.
He added that government is working hard to provide over 500 bed capacity for the isolation and treatment of active cases, and procurement of more equipment, including 2 million face masks for distribution to the public. In Sokoto, Dalat Abdullahi, NTA News.
The Nigeria police have continued to clamp down on those violating the rules guiding the East lockdown in Lagos State. Jesuton Moses, who witnessed the parade of violators, reports that the police have mapped out more strategies that will force people to abide by the rules aimed at bringing down the number of coronavirus cases in that state.
At home following the lockdown order of the federal government as a result of the COVID-19 pandemic for about 5 weeks. Residents of the affected states were no doubt in serious expectation of government easing the order. The gradual easing of the stay-at-home order, which began on Monday, however, came with associated rules such as compulsory use of face masks, social distancing, and curfew. The Lagos State Police Commissioner Hakeem Odumosu, who vowed to enforce the guideline, which he stressed was for the public good, disclosed that cooperation of residents is highly needed in order to fight the pandemic.
79 vehicles are impounded for violating the curfew. 121 persons were arrested for violating the curfew, and 58 were arrested for not putting on the nose mask. It is for our own health.
Meanwhile, the Lagos and Ogun State Police Commands, in collaboration with the Federal Road Safety, are strictly manning the borders of the two states to ensure that vehicles not allowed do not enter.
If you are residing in Ogun State and working in Lagos, you should stay put until it is lifted.
Please, this easing of lockdown is not that everybody should come out yet. No. The presidential directive on who and who should be out is still there, is still in force. But we misunderstood it. Particularly in Lagos, they took it for granted that everybody should just... There are companies that don't have business opening up. For example, I don't know what a car showroom is opening up for now.
The security agencies promised to work hand in hand to ensure strict compliance with every rule as stipulated by the government. In Lagos, Jesuton Moses, NTA News.
With the spike in coronavirus cases and deaths associated with the virus in Nigeria, strategic measures are being applied to ease the burden and strengthen the health system. In this report, Hingino John Adams tells us how this is being achieved in Lagos State.
On the list of countries is how to get a medical solution to beat COVID-19, which is almost bringing the world to its knees. In Nigeria, the federal government and states, especially Lagos, which is managing the highest number of COVID-19 patients, are working round the clock to ensure that the country is free from the unseen enemy. So far, Lagos State has recorded an appreciable level of achievements in the fight, as a good number of patients have recovered and discharged. Isolation centers, which spread across all the axes of the state, were equipped with state-of-the-art facilities and manned by trained personnel. These achievements are not without some gaps.
Even Lagos in itself suddenly now had to build more isolation centers and all that, showing also that we did not quite believe, or we were not quite ready for the numbers that we are now getting.
The introduction of policies and programs by the Lagos State government as the virus ravages the world has demonstrated the political will of Governor Babajide Sanwo-Olu to protecting lives and alleviate the plight of the poor through the provision of palliatives. How can the sector be further strengthened?
Strengthening the healthcare system will be a direct derivative of strengthening and boosting the technology sector. So increasing things like access to, just ubiquitous broadband internet for everybody, whether they're in urban centers or rural centers, is something that's going to actually drive healthcare forward.
We have not followed the proper architecture of the health system in Nigeria, meaning that you have the primary health care, the secondary health care, and the tertiary health care level. So we have ignored that primary health care on which everything else is supposed to be built.
As the federal government continues to make decisions on combating the scourge and improving the health system, Nigerians are hopeful that the sector will come out stronger even if the world does not remain the same again. In Lagos, Hingino John Adams, NTA News.
Thank you, Hingino. Now, Borno State Governor Babagana Zulum has appealed for deployment of more police personnel to Kano town that suffered insurgency attacks for restoration of civil authority in the area. The governor, who made the call while on a visit to the community to assess the return of civil authority, also inspected ongoing housing projects and other infrastructural development at the State University. Maimuna Garba has the report.
Professor Babagana Umara, who drove to Auno, discovered that less than 1/3 of the people are currently living in the community, which is 6 kilometers to the Borno State University. The state government has renovated the houses destroyed by insurgents, hence the need to return people and restore civil authority. The governor requested for the relocation of military personnel on the highway after Auno town to reinforce security to protect lives and property of residents. Governor Babagana Umara assured of government's commitment to support security personnel to ensure normalcy returns to Auno. He assured Auno community to extend the palliative initiative of his administration to them.
Because of a lack of security, the remaining population that are willing to stay in Auno have also relocated to Njimtilo.
The governor inspected the ongoing construction of 500 houses in Auno and directed the Ministry of Reconstruction, Rehabilitation and Resettlement to construct community outreach office in Auno to ensure governance is brought closer to the people. Governor Babagana also inspected Jimtulo 500 housing estate project embarked by his administration. He was also at the Borno State University to assess construction of staff quarters, lecture hall and auditoriums, which is at 80% level of completion. In Maiduguri, Maimuna Garba, NTA News.
You're watching Weekend File on NTA Network Service. We are looking at the state interventions and the tall aim of flattening COVID-19 curve in Nigeria. The program returns very shortly.
I wish to once again commend the frontline workers across the country who, on a daily basis, risk everything to ensure we win this fight. For those who got infected in the line of duty, rest assured that government will do all it takes to support you and your families during this exceedingly difficult period. I will also take this opportunity to assure you all that your safety, well-being, and welfare remains paramount to our government. I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic. This is our collective loss, and we share your grief.
Action. Make your home the place to be with GoTV's super cool kids channels. That sounds fun. From funky friends that'll keep even the little ones busy. All right, everybody, let's do this! To learn as you watch educational shows for curious young minds. You can do some amazing things. There's plenty for everyone. Tune in to our kids shows and get everything you need to keep the kids entertained and learning the fun way. GoTV. Live it, love it.
25th February 2020, Nigeria. It is real. It is a nightmare. It is killing people all over the world. It is COVID-19. Compliance with the various states in Nigeria, the current measures will flatten the curves. Shutting down is not an act of wickedness, but an act to save lives. Stay home, stay safe. Observe social distance. Always put on a face mask while leaving your house. Make sure you are on a tricycle alone. Cars and buses cannot carry more than half their passengers. Always remember to wash your hands. Together, we will defeat COVID-19. This message is brought to you by the National Orientation Agency, Nigerian Film Corporation, powering possibilities.
As
immune system increases the chances of victims surviving COVID-19. A corruption-free society creates opportunities for citizens to thrive and prosper. Build your immunity. Stop corruption now. Report all acts of corruption to ICPC on this toll-free number 0800 2255 4272. This message is brought to you by ICPC and NTA.
There is a lot of fake news and report circulating, especially on social media, on the coronavirus. Do not believe or partake in the spread of these fake reports. If it is not on the official website or news from the Nigerian Center for Disease Control, NCDC, disregard such report. Only together can we beat this virus. Only together can we overcome this pandemic. Follow the instructions and guidelines provided to combat this virus. Most importantly, stay at home. Self-isolate, regardless of your status. The virus doesn't move unless we move. Let us work together to better Nigeria. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
So we thank you for staying with us. And our guest tonight is Dr. John Oladejo, Incident Manager and National Coronavirus Emergency Operations Center. He's going to be reaching us from Kano via Zoom. But before we bring him in, let's take the first two reports before the conversation. Kano, northern Nigeria's commercial hub, has for the past 2 weeks been without its usual hustle and bustle due to lockdown order imposed to prevent further spread of COVID-19 in that state. Abdullahi Mustafa in the next report tells us more about this and other interventions to lower the tally and contain community transmission.
Kano State Government's COVID-19 response started weeks before the index case surfaced. This includes constitution of a task force committee, establishment of isolation centers and closure of its boundaries, among others. The exponential rise in the number of cases led to the lockdown of the state. 2 weeks into the lockdown, commercial activities at all major markets and business activities have ceased. The busy streets are either deserted or with less vehicular movements.
So we hope people will take advantage of this and behave well. Also, I'm appealing to the people of Kano State to be committed to the protocol of COVID-19.
That notwithstanding, more people in the state, including a good number of medical personnel, are getting infected.
And we are working on the mandate of His Excellency, the Executive Governor of Kano State, to ensure that at least each LG in Kano has a sample collection center.
As at late hours of Friday, Kano has 547 confirmed cases and 18 fatalities. This concern informed the state government's decision to embark on fumigation of hospitals and providing them with sanitary facilities as well as personal protective equipment. While testing capacity has been increased with the support of federal government and organizations, the next step the state government says it is going to take is to increase awareness on the use of facial masks, keeping physical distance and enhancing personal hygiene to achieve the desired result. In Kano, Abdullahi Mustafa.
As the phased and gradual relaxing of COVID-19 lockdown took off some few days ago, residents within the Abuja city have continued to flout the physical distancing order of the federal government to curb the spread of the pandemic. Ifeanyi Zumba reports that residents who spoke to NTA Crew said the desperation to make ends meet and rush without a precaution on the need to avoid close contact.
Abuja witnessed large turnout of crowds at banks, even at business environment, with the ease of lockdown and people disregarding the rules of social distancing, all in the name of making both ends meet.
How do they expect us to observe a social distance? What is the meaning of social distance? I should give you some gap. Yes. If I'm hungry do you think there will be that space between me and you? There will be no space. I want to come close to you so that we can make ends meet for my family at home.
Others say the public must accept the dangers posed by the pandemic before they can fully comply with the social distancing directive.
The information is beginning to sink. Give it a little more time. People will be able to know that, yes, it's better I give this distance to stay alive than for me to transmit this disease if I have it.
For the mask, definitely I can associate it with ignorance.
Whatever cloth fabric you're putting on, make sure you blow air through it to ensure you're not wearing a wrong or a weak facial mask. And if air is coming out, remove it immediately and look for a suitable one.
The sector commander, Federal Road Safety Corps, and Director, Road Traffic Services say it is typical of most Nigerians to be coerced before they do the right thing.
Obey what government directives are. Refusal is what brought the influx of people into the town.
We are all over the place together with other security agencies to ensure that the physical distancing and social distancing is strictly adhered to.
Social distancing is very vital to mitigate the spread of coronavirus. Residents of Abuja and environs are advised to adhere strictly to the directive and constantly wear their face mask to curb the spread of COVID-19. In Abuja, Ifeanyi Ezumba, NT News.
Thank you, Ifeanyi. Let's now bring in our guest, Dr. John Oledejo, the Incident Manager, National Coronavirus Emergency Operations Center. Dr. Oledejo, good evening and welcome to the program.
Good evening. Thank you for having me.
All right. But if you wouldn't mind, could you just put on the light in that room so that you will be better illuminated?
Okay, let me do that.
Yes, we need to have a clearer picture of Dr. Oledejo so that we can appreciate him much better.
Are you seeing me now?
All right. That's much better. Thank you indeed for joining us. Now, you are one of the experts sent to Kano by the federal government at the initial stage of the outbreak of coronavirus in that state. Let us know what the situation is at the moment in terms of infections and what you and your team have been doing to contain the virus in that populous state, Kano.
Thank you very much. We were sent to Kano to actually see on the spot what the situation is by the Honorable Minister of Health. And when we got there, we were able to talk to the governor, His Excellency, as well as all the team members of Kano State. So as we speak to you now, we have more than 3,000 health workers that were experts that were actually deployed to Kano to assist Kano State in actually containing this outbreak. So we have people who are actually working in the EOC. We have our experts working on surveillance activities, on case management, and other pillars of the EOC. So we have been, able to, train health workers on IPC, that is infection prevention and control, and then we were able to equally, train more health workers on contact tracing, and as well as other activities that are related to containing of the outbreak. So there are a lot of progress we made with the support of the governor, because the governor has been so supportive. He had a listening ear. He has actually deployed a lot of materials, men and women, to ensure that this outbreak is contained within a very short period.
All right. Kano presently has over 500 cases, as we've heard in the course of this program. What other extra effort is being made in Kano, particularly, to curtail the community infection? Because it is community infection that has, shut up the number of cases to up to 500 within just 2 weeks.
Yes, thank you very much. The major thing we are doing is detection of this disease within a very short period. And we are doing that through contact tracing, which is actually done at the state level by the State Ministry of Health. And we are actually using a software called SOMAS, which is the software for surveillance, outbreak response management, and analysis system. And equally, we are going into the community, engaging them through our risk pillar experts who are actually, telling them exactly what this disease is all about and what we are expected to do. So, using contact tracing, and immediately we we are able to detect the virus. We take the patient to the isolation center. So we are grateful to the governor who has actually provided enough isolation center within a very short period for us to be able to isolate all these patients. And then we have our experts, our case managers that are actually treating them. And that is the reason why we are detecting to be able to isolate immediately. And that one will assist us to be able to contain the disease within a very short period of time.
All right. Now, the Presidential Task Force says it has received reports that some states are running out of bed spaces. Which are these states, and what can be done to step up capacity for isolation and treatment?
As a matter of fact, we have some states. They actually have the isolation center, but some of them are yet to be completed. They are still, putting one thing or the other. Not that they don't have the building, they don't have the best space, but some of them have not yet completed those best spaces. So the government is now looking out for temporary sites, some temporary center where these patients can be isolated before those centers are complete. There are just one or two things that are supposed to be put there so that it will be comfortable for the patient. So these are the things. These are the strategies we are actually working on. So governments are actually looking out to some temporary sites where people, these patients can be comfortable and then treated, and within a very short period, they will leave the isolation center when they test negative.
Now, two states in Nigeria, Kogi and Cross River State, are said to be COVID-19 free, presently. What are your concerns about this? Because we heard that there are certain differences which are yet to be resolved with respect to the status of those two states.
Thank you very much. As a matter of fact, Kogi and Cross River, they are yet to report COVID-19 outbreak. So, our major concern was that we have not been able to really be part of that support in that state. The last time our team member, the RRT, rapid response team, were deployed to the place, they were actually sent back because they were told that they are coming from states that have been exposed to the virus. Therefore, they needed to be in isolation for 14 days. As a matter of fact, this RRT member that we deployed to the place, they are COVID-19 virus free. They are there to support. They are experts in this area, and they are there to support the state. And so that is more reason why we were unable to really, penetrate into that state. My worry is that some people that are coming from this exposed state may be having the disease, but because we have not been able to, have opportunity to support the state, we will not be able to know. I think if we start looking at our hospital record, checking people that are coming from high-risk states like Lagos, like Kano, that are coming to that particular state, we will see that we will find one or two that are having the virus. But we have not been able to, to do that, and it's highly worrisome. This will be taken up by the task force because they are the umbrella, they are the lead of this outbreak. So we have actually sent our report to them, and it's already receiving attention.
All right, thank you, Dr. John Oledejo. We're going to take a short break now. When we come back, I will return to you for us to conclude this conversation. Thank you indeed. This is Weekend File on NTA Network Service. We'll take a short break now. When we come back, the program continues.
Mama, Uncle Kim just called me. His wife just gave birth. Hey! If not be God, though, now who go do am? Now who go do am? Hey, I thank God. Boy or girl?
I was too excited to ask. Let me get my phone and call him. Mama, it's a... Mama, what's wrong?
So, I no fit see my grandpikin now as dem do obodo oyibo.
Mama, I have a surprise that will cheer you up.
Introducing Sunday Data Plan. Enjoy Sunday browsing. 200 Naira gets you a whopping 1.25 gigabytes. Glow Unlimited. Cadbury Hot Chocolate 3-in-1. A delicious combination of rich cocoa and wholesome goodness of milk. Just add hot water to get an instant chocolatey treat. Cadbury Hot Chocolate 3-in-1. Just add hot water. Available in stores at 18 Naira.
GoTV dey your side as times dey tough so. We don't see your loyalty and we appreciate the journey where we don't work out together. That na why GoTV dey sama you with better upgrade to the next package as you stay connected or reconnect. We dey your side with correct entertainment. You fit save up to 75% because now we. Not to stay connected or reconnect, GoTV go upgrade you at no extra cost. Wow! Stay connected with GoTV self-service payment options. Visit GoTVAfrica.com to gather more information about this better discount and our payment options. GoTV dey your side. Enjoy GoTV Wow Awoof. GoTV. Live it. Love it.
Now believe this Koroti. You no fit touch black man. If you like, gather the whole Niger, come together, make the cough. Nothing.
Which one you want?
Give me V&D.
I beg, get small pieces.
How much you want to give him?
Give me 200. Take your change now. You don't want your changes.
My people, this coronavirus, na serious matter. May una wash una hands regularly. Come use alcohol-based hand sanitizer. If you no see water, wash your hand. Make una sit down for house. You see the virus so, e no get leg. Now we dey waka kurukere. No waka around, make the virus for die. No forget, say, the betterment of our people. Now for your handy day.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Do you not know that our enemies have no face? They are indigents of no state. They come from no place. And if this boat capsizes, every one of us will go under. So when the drums sound, let everybody answer. Do not say, I am the Iroko when the forest is burning. Do not say, I am the Obeche when the forest is burning. Our differences will not stop us from perishing together. So when the drums sound, let everybody answer.
Welcome back. Just as all efforts are geared towards reducing COVID-19 cases in Nigeria, the present concern of the Lagos state government is a lackadaisical attitude of a large percentage of residents to the directives surrounding the East lockdown, which could prolong winning the war against the virus. Nosa Usula reports that the state government is now giving more push to security agencies to intensify enforcement and beef up safety measures.
Relaxation of the lockdown in Lagos State showed poor level of compliance with the guidelines reeled out by the federal and state governments as residents trooped out with little or no regard to social distance and other safety protocols. Lagos State remains the epicenter of the disease with over 1,500 confirmed cases. Despite rules banning groups of more than 20 people and stipulating that individuals remain 2 meters apart, large groups of people often gathered by the road waiting for public transport or at banking premises struggling to enter. However, in a crucial difference to pre-lockdown life, most people on the streets of Lagos wore face masks.
The removal of this lockdown will even cause more harm.
We are still skeptical about the fact that we have to come out after the lockdown due to the health issues going on.
Social distancing in Lagos is not easy. You know, the population of people in Lagos here is on the high side.
The Lagos State Commissioner for Information and Strategy explained that governments would not be applying force to enforce social distancing among residents, but would continue to sustain campaign awareness about the virus in the state.
People have called us to say that some people are hard of hearing, we should bring in soldiers, we should send dogs after people where you have crowds and all of that. But the governor made it clear the last time when he addressed us that he is going to tell the security agencies to respect the fundamental rights of our people, the dignity of our people. So we are not going to send in dogs, we are not going to send in soldiers to start beating people with koboko.
The Lagos State Police Command has been making arrests while enforcing the presidential and state government's directives on the cessation of movement to curb the spread of COVID-19 pandemic. In Lagos, Nosa Usula, NTA News.
Thank you, Nosa. Now, let's return to Kano, where we still have Dr. John Oledejo, the Incident Manager, National Coronavirus Emergency Operations Center. Now, we learned that fact-finding teams have been sent to Kano and Jigawa states to investigate the cause of deaths in those two states. Now, is there any preliminary finding or findings, as the case may be, so far?
Thank you very much. The findings will be made known to the public before the end of next week. So our experts, led by a renowned epidemiologist, Dr. Saniguazo, is already there and is working all day night to ensure that the preliminary report is out. So immediately it is out, he will address it and then inform the whole public on the outcome of this report.
All right. And what is the current statistics, in terms of infected health workers in Nigeria, and what is actually responsible for such very key persons to be infected by the virus? And, we've been talking about the PPE, which most of them should have. So, we're wondering how a number of persons who are on the front line are beginning to get infected.
Thank you very much. As at this morning, we have about 100 health workers being infected across the 34 plus FCT state. And all of them are actually currently receiving treatment across the state. And they are all, I spoke to some of them of recent, and they are all in good mood. They are, getting better, and they are not losing hope. The major reason which we are still investigating was that some of them were trained before before we had this first index case in 27th of February, and some of them were actually on the job. We treat them on the job. So it's not something that we can specifically say, is it as a result of the wearing of the PPE or being too much exposed to the patient. So for my own opinion, I will submit that because I spoke to some of them. They were just like, oh, we dressed very well. We did all what we could, but we couldn't really know why. Most of the time we were carried away when we are treating patients, and we are carried away when we are, among the patients. So it may have been a sort of a slight exposure from their home parts that is causing it. But our IPC experts is already in Kano and other states, and they are actually training the trainer on IPC. So within a very short period, they will be able to cover all the 34 plus FCT, and then we are now having an IPC focal person in each of the treatment centers. Because before they go out, that person must have certified you that, oh, you have dressed very well. And then we are looking at how many hours are they actually working. So if they are working more than the necessary number of hours, we have to withdraw them back so that they can rest. So all these things are the areas where we're actually looking into. And we don't want it to be more than this number.
All right, Dr. John Oladejo, Incident Manager, National Coronavirus Emergency Operations Center. We'd like to thank you and appreciate your time and your insight into the program. We thank you indeed for being part of our show this evening.
Oh, thank you for having me. Good evening.
You're still watching Weekend File on NTA Network Service. We'll take another break. We'll be back shortly.
In this time of despair, our country, Nigeria, needs us now more than ever. We stand a chance to save our great country, Nigeria. A chance to rise up from this pandemic stronger and better. What will be the gain if we do not learn from other countries and observe the lockdown to stop the further spread of the virus? If we loosen our guards and allow this virus doom our very existence, then what have we gained? This is the call to every Nigerian to unite as one and stop the spread of this deadly virus. Stay at home and stay safe. Remember, the virus doesn't move unless we move. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
I just don't understand this coronavirus thing. Is it real?
See, coronavirus, known as COVID-19, it's a global problem and has killed thousands of people in China, Italy, Spain, UK, US, and other countries around the world.
Okay. Now, why are they saying that we should stay home?
Because if you go outside and get in contact with someone who is infected, you become infected and then come back home, affect your family. That's how it happens in other countries.
Now, please, help me explain what this social distance is all about.
See, as we are now, the virus travels through the air and by touch. We must maintain 6 foot distance at all times.
Oh, so it's not by washing my hands with soap and water or hand sanitizer that is only important?
Washing of our hands regularly is very important. But we must come together and fight this virus like we did Ebola. It is our responsibility to each other.
President Muhammadu Buhari commiserates with government and people of Sokoto State over the passing of Sheikh Haruna Waziri Usman, 96, who passed away after a prolonged illness. Sheikh Usman was the patriarch of the Waziri Tambuwal family, Governor Aminu Tambuwal's uncle. The president said Sokoto State and indeed the nation lost a noble and distinguished scholar. President Buhari prayed that Allah will forgive the shortcomings of the community leader and grant Waziri Tambuwal and family the fortitude to bear the irreparable loss. Now let's check the weather situation for tomorrow.